Hi, welcome to our first Facebook Live. I'm Dr. Larry Seidman,
I'm Dr. Tiffany Meyer.
and we're partners of Nova Pediatrics. So thank you for joining us today at our first Facebook Live talk about parenting in a pandemic, tips to keep the calm at home. And this was a very good article that we found from the healthychildren.org, and that link is on our website. And you can download the article. Facebook Live. I'm Dr. Larry Seidman.
I'm Dr. Tiffany Meyer.
And we're partners of Nova Pediatrics. So thank you for joining us today. First Facebook Live talk.
So we actually we're just going to talk briefly, and then we're going to open it up to questions. And so this link is available on our website, and it's supported by the American Academy of Pediatrics. So obviously we're going through very difficult times right now, and it's difficult to parent even in normal times, but this has added additional challenges to parenting. And so we just wanted to review with parents and anyone who's interested some tips and some ways to kind of help you and your children survive these challenging, different, unusual, new normal times.
So there are a lot of good changes happening in Nova Pediatrics, and we're practicing safe distancing. And Tiffany and I are 6 feet apart, and we have our masks when we're going to go in and see patients. We have them off now so that you can, see our faces. And then we have the alcohol hand sanitizers, and we've started some policies and procedures to keep your kids safe so that you can feel comfortable coming into the office. Our Springfield office is just seeing well children, and our Woodbridge office has the separate times to come in for sick and well. And we've started doing the telemedicine visits to help you bring our Nova home to your home.
And so there are several ways actually that you can do telemedicine visits. The good news is most insurances now are covering them. And you can do sick visits by telemedicine. You can do well visits by telemedicine if your child is not due for any shots or doesn't need a form for school or camp. So please feel comfortable knowing that there are ways to continue your medical care even during these uncertain times.
So we'll start right in with this parenting in a pandemic. And the first topic is addressing your children's fears. So Tiffany and I are both parents, and most of the providers here at Nova Pediatrics have had the experience with sick kids and can provide some reassurance to you and your families. When a child has a question about maybe one of his friends or grandparents are sick, answer the question simply and honestly. Recognize your child's feelings. You can say, "Wow, I can see that you're upset because you can't have your friends over." And so acknowledging.
And I just wanted to add to that too. So, maybe your children can't meet one-on-one with their friends, but there are other ways to do, virtual visits, Facebook. And it's good even to set up a weekly or every 2 weeks a meeting with friends. And so both for parents and for children, it's nice to still have those outside contacts. And there are definitely, thank goodness, in our current world, there are technologies that help us stay connected.
Right, our friends do a Zoom meeting every Saturday night, and even though we're in different cities, we can stay connected that way. And keeping in touch with loved ones. So I've heard from friends from high school that I haven't spoken to in over 30 years. So it's nice, reach out to an aunt, an uncle, grandparent, just say, "Hey, how you doing?" And they'll be glad that you reached out to them.
And grandparents really enjoy the phone calls or the FaceTime. It's just nice to connect with them because they're feeling especially kind of isolated when we're trying to keep them safe from COVID-19.
The next point was model how to manage your child's feelings. So be a model. If you have a lot of anxiety and fears, speak to your spouse, maybe not in front of the child. If you have a lot of worries and concerns and have the news on all the time, this can really make for a lot more anxiety for the kids. So maybe take a break from the constant media.
And then another thing too is telling your child before you leave. If you're a parent who has to go out to work, you want to let your children know, I'm going out to work today, but I will be home, and try to reassure them, because many kids, are very afraid that their parent, may get sick or may die. And so it's nice to reassure them and let them know you're coming back and where you're going.
And my wife, who's a child psychologist, said use the word very a lot. So let's say they know someone that's very sick or passed away, then you can say, wow, grandma was very, very, very sick, to kind of differentiate that experience from the child's fears. And so the good news is, most healthy kids, healthy adults do well. And so kind of reassuring the child that, that person that passed, was very, very old or very,
right,
very sick.
Just to emphasize it. And another point too is looking forward to things. Every day for children, unfortunately, may be the same thing, distance learning and maybe going outside some, but maybe plan something, that's obviously safe and still social distancing, like a movie night at home or a board game night at home, or something for them to look forward to. Maybe even it's a trip, just taking a car trip and driving around, but plan something for ahead and let them know, we're looking forward to, we're gonna, next Saturday, we're gonna have a movie night. And, just even looking forward for them, saying, this isn't going to be forever. We will get through this,
right,
and things will get better.
We will get through this. Offer extra hugs and say, I love you more often. You can't love them too much or hug them too much. So
yes, especially right now.
Yes. Some kids may be a little more needy and may even, digress to a little of their earlier behaviors, and they may need a little bit more loving from their parents at this time.
And that's very, very normal.
It is normal.
Very expected and very normal.
I think also with if there are two parents in the house, to really set some reasonable guidelines for the kids, be on the same page with the two parents, that one may feel, COVID isn't so bad and you can go play outside, and the other parent is very worried and says, no, you can't do anything. So there's not one right or wrong answer for each family, but the importance is just be a team, be together, talk parent to parent, and so that the child feels that you're in alignment and together.
Yes.
They will play one against
Absolutely.
the other.
That's true. And then, something else that's very important is keeping healthy routines, right? So most kids function well with routines. And so keeping a routine, even though school is not particularly in session, still, especially if you have distance learning, but stay on a routine. Have your child get up at the same time each day. Have a schedule for them to do, whether it's schoolwork and whatever they need to do, but have a schedule and a routine that you keep throughout the day. Not that it's just a free-for-all and all day video games.
And it's a good thing that the online learning is back in session, and so teenagers tend to sleep on a 25-hour schedule. So left to their own devices, every day they would sleep an hour later and later, and then they get out of phase. So being back in school, college, high school classes, even if they're online, it gives them an incentive to get up in the morning, start their day. And if you can keep as much structure, your wake up routines, getting dressed, showering, do some homework, play outside, come back, having family time, and then reading before bedtime, they will thrive on that routine. And once school gets back into session, it'll be better.
Easier for them. And and I'm sure adults realize this, but emphasizing getting dressed each day. Kids may have the tendency to want to hang out in pajamas all day, but really, if they can keep in a routine and actually get dressed, so it kind of it signifies that it is a new day and it's not just one day spreading into the next day.
Yes. And then bedtime routines. Many children have struggled with their bedtime routines now, and so expect that there may be some extra clinginess, wanting to come into your bed at nighttime. And so I'll give you a tip. When my daughter was 18 months old, she used to come into our bed at night and wake us up. And so we purchased the sleeping bag and we put it in the corner of our bedroom. And so if she woke up, had a bad dream, she would get into the sleeping bag. And then after about several months' time, she felt comfortable, and then she just went back to her own bed in the middle of the night and then started sleeping there. So that was a tip that helped us. So it kind of empowers the child to find a place that can be close to the parent, but without waking your sleep. And everybody sleeps better in their own bed.
Correct. And so trying to keep that bedtime routine. So trying to still go to bed at a regular hour, not allowing young kids, middle school kids, and even obviously high schoolers staying up too late. Try to keep them on a routine. I know it gets harder the older they are, but trying to keep them on a routine and still waking up around the same time each morning.
The next area was using positive discipline. So your children might be acting out due to anxiety or fear, so you try to redirect the bad behavior. They might misbehave because they're bored, and so getting a little time outside or doing something beside being on the videos may be helpful.
That's right. And so, redirecting, right? Trying to kind of, if they're, doing something they're not supposed to, as Dr. Seidman said, to try to get them outside, get them, a lot of times acting out behavior is they're bored or they're looking for attention. Keep in mind too that maybe think about it. Oh, was I too busy today? Did I not give my child enough attention? And just try to step back a second and think, why is this happening?
Maybe having a special time each day for each of your children that they know and count on. Wow, this is my time with mom or dad. That'll really mean something. And this is kind of going back to the olden days where people actually played board games like I did when I was a kid and played, Monopoly or cards. So it's really a chance to reconnect with your kids on a very special level.
Absolutely. And that actually is kind of a good segue into creative play. So, arts and crafts, go back to, old school things, arts and crafts and the board games, as Dr. Seidman said, but just allow your child creativity time that's away from the computer and the video. So
try to catch your child doing something well. Use rewards and privileges, help them to be part of the household responsibilities, assignments, chores, getting along well with their siblings. You might put something on the refrigerator and make some stars or point system, and they can achieve that, and that's the currency.
And, and that's as just kind of continuing on that, reward the positive, right? Catch them doing something great and then emphasize it. Say, oh, wow, you were so good today. You put your dishes away. You were so good today. You did your work without being asked. So just, catch them doing something good and make a good big deal about it.
And know when not to respond. Sometimes that's even more important, is ignoring the little things. They will reach out for either the positive or negative attention. So cut them a little slack, focus on the positive, There's something called the Positive Coaching Alliance, which is done with the high school and college youth, and it's 4 good positive comments to 1 negative. So if you keep in mind that 4-to-1 ratio and catch yourself, have I said 4 good things, or have I picked on a lot of little things? So it's really helpful for us to
That is
be
very
cognizant.
true. Yes. And some of the positives might even just be giving your child a hug. Just say, come here and give me a hug, or I want to come give you a hug. And so that's one easy positive you can do very quickly without even thinking much about it.
And try not to use any physical punishments, use timeouts. Really, this is a time when everybody is cooped up in the house. So you as a parent can take a timeout too. Say, hey, I got to go take a walk, and just be cognizant that it's really stressful, and kids and adults show stress in different ways.
Yes, absolutely. And that also the taking the time out for you as a parent too. Take care of yourself as a parent. So yourself, if you're not getting a meal or if you're not getting something, you're going to get cranky too. So make sure that you realize you've got to take that deep breath, or you need to take care of yourself in a minimal way so that you can give that positive behavior to your child.
If you meditate, there's a good app called Headspace, which I've done for the last 2 years, and do 5-10 minutes in the morning. So keeping a routine for yourself too, eating healthy, getting some exercise, getting sleep, meditating, focusing on the positive, things will get better. All these basics will help your family. And take a breath.
Sometimes that just feels good to take a breath.
Definitely.
And Dr. Seidman, we didn't explain. I'm a parent of 2 young girls, ages 11 and 9, and Dr. Seidman has.
So I have a son who's 30 and recently married, and a 28-year-old daughter who hopes to get married in September when this all blows over. So we're at different age in our lives and kids, but your child is always your child, no matter what age. So little kids, little problems; big kids, big problems.
Sure, absolutely. So,
but take care of yourselves out there. This will get better. We wanted to give some calm and reassurance that we are here for you. Our practice has been here for almost 60 years now. And so we want to bring our home to your home. And so we'll open this up for, some questions. And before we do that, thank you for reminding me, we have a couple new pieces of technology in the office that this is something that's, come up with COVID. There'll be more and more research as they, develop treatments and vaccines. And so, something simple that we're using now. This is a thermometer that can take the infrared and take the temperature at a distance. So we just have to, direct it at the forehead, and you can see the temperature is 97.2. And so this is something we do on everybody coming into the office, every parent, every child, every staff member. We take their temperature. And this is hands-free, and it is available online. The pulse oximeter is another tool that we use to manage the children that might have respiratory distress or any respiratory difficulties. So we've been using this for years, and there's an article on our website which shows that this might aid in the earlier detection of patients with COVID that are positive, and give you some indication if your oxygen concentration is coming down to get help sooner. It may also help for those that are convalescing after they've been discharged from the hospital. So this is called a pulse oximeter.
What's the name of the thermometer again?
So this is an infrared thermometer. There are many, many brands available. The technology is really improved, and you certainly can get these online. We could post that after the talk. Thank you for bringing that up. There are several references in the article at the bottom, more information and more links. So please check that out, and you can, if you have any questions, you can send to us. So, okay, so we have some questions here.
Okay. I can scroll.
So, one of the questions was, what do you recommend for parents regarding going to the pools this summer if they are open, and summer camps? And so thank you for that question. So these are all good questions and hard questions, and not knowing where things will be this summer and the fall. For the summer camps, I think we should really delay waiting on that until the camps will come up with their recommendations. I think if a family has high-risk folks at home, they should really be more careful and choose to keep their kids out of camp, even if it's open. And the swimming pools, I think we should still wait another month, see what's happening in Fairfax County. And the general approach is avoiding the crowds. So it's not necessarily the pool itself, which is chlorinated. It's that you're going to be crowded in everybody's face amongst 50 other kids. So I think it's reasonable to exercise some little more caution and judgment in that.
And I think most experts are saying that social distancing and wearing masks in public and keeping 6 feet apart is probably going to continue for many months to come still. So.
Another question is, we don't know about the plan for schools to open in the fall, and Fairfax County sent a survey to parents asking what they would feel comfortable doing, opening a few days a week, opening for half a day, smaller class size, staggering, when students attend school, partial distance learning. What are your thoughts and recommendations? So again, it's a very good question. One of our experts, Dr. Ben Schwartz, who I had a chance to speak to before the meeting, said that they're currently going to have a call with Fairfax County Public Schools by the end of the week, and may have more information about the plans. And then, we will continually post any updates to that. Now, we have a question. Is it okay to play outside? So it seems like it'd be good for their mental health. So I think, again, riding your bike outside, taking a walk outside, walking the dog outside, I think that's all great. If you'll be, playing on top of everybody in a group sport, like it's, basketball or football, it's tackling, it would make sense to still exercise some caution in that regard. So playing outside, I think it's a great idea to get some exercise. Absolutely. Maybe avoid the crowds.
And I also have to say, probably avoid playgrounds, right? At this point, it's difficult to sanitize, monkey bars and swings and stuff like that. So point. For a public playground, you probably want to avoid the public playgrounds, but definitely please don't avoid, taking walks or going on bike rides or getting some fresh air. So yes, definitely, as we have these nice days and hopefully many more nice weather days to come, that please, make sure that you and your children get outside.
When do you think it's safe to travel with children for them to start playing and be with their grandparents? So again, the travel depends on the status of disease in these communities and the health of the grandparents. So really check that before traveling. I think, according to Dr. Schwartz, it's really not the travel as much as the other risk factors. how sick are the grandparents, and the status of the disease in that community.
And the and just another note is that, you know, currently the countries, each state's going to have their own plan, but the country is talking about the phase, you know, different phases and how to kind of gradually open things up. And, you know, the majority of the phases 1, 2 are where the older folks still remain, you know, kind of away from the general public. So just be cautious and maintain social distancing, but definitely don't avoid speaking on the phone or doing video chats with your older relatives, because they need that contact too.
Remember that this is a respiratory virus, and I keep just a little bottle of rubbing alcohol, and you can spray that on your hands. So
70%
alcohol,
greater.
And that's easy and portable. And this is the same as you could get at the dollar store if you clean your eyeglasses with. And so this is good to not only clean your hands, you could clean the surface of your phone, the computer keyboard, if you're using a phone in the house. So it's good for any surface. If you're going in the supermarket and you want to spray the handles there, doorknobs. So I find that that's a handy low-tech way of preventing any spread from hand to mouth.
Great.
So I think we're going to wind down now. It's a quarter to the hour. So thank you very much for everybody attending. I'm Dr. Larry Seidman.
Dr. Tiffany Meyer.
And we're partners in Nova Pediatrics. Thank you so much for attending our first Zoom Live, and look forward to seeing you again for more talks in the future.
Thank you.